The Lightning Process podcast. Using the tools of the mind-body connection for health and happiness. Hi, Dr. Phil here. Today I'm talking about long COVID and, excitingly, the research that suggests there are ways out of it. Today's piece of research is from 2023 and it's a paper by Coote and it's a randomized control trial, an RCT. These are considered to be the best ways of deciding does an intervention or approach work. What you do is you compare two different interventions, in this case CBT and care or treatment as usual. And you take a group of people with a condition, long COVID, and you randomize them. So randomly you select them to go into one group or another. And then you compare the outcomes. Was it any different? Did going down one path, one arm, produce better outcomes than the other? And what they found was people who had the CBT over 17 weeks improved. They statistically significantly reduced their fatigue. Now what that means in research jargon is they got better results, much better results, and more than you just say by chance. This is really meaning that there's something going on here, some effect. So reduction in fatigue, which is one of the core symptoms of long COVID. And really long COVID is a bunch of symptoms. That's the thing we most know about it. If you can reduce the symptoms, if you don't have the symptoms anymore, then you don't have long COVID, because you have to have the symptoms to have long COVID. So you can get rid of your fatigue, then you can potentially get rid of one of your symptoms, get rid of all of them, then you can get yourself out of having long COVID. So really exciting. They found that the results were maintained for 6 months. So that's the length of the trial that they did. So continue to be well. And there were no adverse reactions, so no side effects of having the CBT. So really, really good news. So when people say, oh, nothing works, nobody gets better, it's not true. The research is out there that people do actually get better. Yeah? It's early days, 100 and something people were in the studies, but it is good quality evidence that there are routes to recovery. So that's our first one. We'll look at some more on the next video. The Lightning Process podcast. Using the tools and the mind-body connection for health and happiness. If you'd like to know more, please visit us at lightningprocess.co.uk.